Sight is a precious gift, and it allows us to experience the beauty of our world in rich and wonderful ways. Every year, during World Sight Day, the eye care professional community of Malaysia promotes eye health awareness so that we appreciate and preserve this incredible gift of sight. This year, the focus is on myopia, commonly known as short-sightedness. Myopia is the leading cause of poor vision globally. Myopia typically develops and progresses during childhood and teenage years. Although the poor vision associated with myopia can be improved with glasses or contact lenses, parents and eye care professionals are greatly concerned with the increasing number of children developing myopia and in many cases becoming highly myopic. In addition to causing inconvenience due to dependency on glasses and contact lenses, myopia, particularly high myopia, is associated with many sight-threatening conditions such as retinal detachment, glaucoma, myopic macular degeneration, and cataract. Medical research shows that the odds of people with high myopia developing retinal detachment, a potentially blinding condition, is more than 12 times higher than the normal sighted person. High myopia also increases the risk of myopic macular degeneration, a form of irreversible degeneration of the retina. The odds of developing myopic macular degeneration among people with high myopia is estimated to be a staggering 800 times higher than normal, affecting up to 60% of people with high myopia. High myopia also increases the odds of developing cataract by 4 to 5 times, and the odds of developing glaucoma by 3 times. Therefore, myopia is just not a simple eye problem that can be corrected by glasses or contact lenses. It has a lasting, long-term health impact. But just how many people are affected by this problem? In the year 2000, it is estimated that 23% of the global population has myopia. 20 years later, in 2020, this has increased to 34%, affecting a staggering 2.6 billion people, or 1 in every 3 people worldwide. Worryingly, this percentage is projected to increase to 50% by 2050, affecting almost 5 billion people. In Southeast Asia alone, where we are, the prevalence of myopia is even higher, at 46% in 2020, and is expected to increase to 62% by 2050. Soon, normal-sighted people will be outnumbered by people with myopia, such that having myopia is the norm. But what about high myopia, where the risk of future eye complications is much higher? It is estimated that today, there are over 400 million people worldwide with high myopia. This number is estimated to increase to almost 1 billion people by 2050. And there will also be a similar corresponding increase in sight-threatening eye diseases associated with high myopia. It is clear that myopia is a significant public health concern. But more than that, myopia also presents an economic concern. Uncorrected myopia costs the global economy 250 billion USD. That is more than 1 trillion Malaysian ringgit per annum in loss of productivity, and another 250 billion USD per annum in cost of specialist care for treating eye diseases associated with high myopia. In Southeast Asia alone, this loss of productivity costs approximately 30 billion USD annually. The situation in Malaysia is no different from the other countries. We face similar challenges of increasing prevalence of myopia and high myopia. And we intuitively know this to be true, as it is now a common experience to see more than half of the children in an average classroom wearing glasses for myopia. In a WHO-sponsored study done in Malaysia in 2003, 33% of 15-year-olds in Malaysia already had myopia. Now, almost 20 years later, the percentage is much higher, in keeping with similar trends seen in the rest of the world. This myopia epidemic is now impossible to ignore and has wide-ranging health and economic ramifications. This short-sighted problem demands far-sighted solutions, and the time to take action is now. So what can be done? Well, the good news is that development and progression of myopia can be prevented. However, the window of opportunity is narrow and is only possible during childhood and teenage years. Studies show that the increasing ambient light, especially in an outdoor environment, protects against myopia. It is recommended that children spend at least 2 hours per day outdoors. This simple, healthy intervention is powerful and appealing, especially since it is also helpful in reducing the risk of obesity and diabetes. Additionally, excessive near vision activities such as reading, screen time, and online classes are associated with myopia progression. It is recommended that near vision activity is reduced. Give children the opportunity to relax their eyes by observing the 20-20-20 rule. For every 20 minutes of near vision activities, take 20 seconds off to look at something at least 20 feet away. Also, bring children for an eye assessment. Many children have myopia that is undetected. Without the appropriate glasses correction, the persistent poor vision may increase the rate of myopia progression, as well as affecting the child's learning abilities. Since myopia and future adverse effects of myopia are not reversible, timely intervention during childhood and teenage years is of great importance. These interventions involve concerted, collaborative efforts from children, from parents, from teachers, eye care health professionals, as well as policymakers. Parents can play their roles at home in ensuring good eye health care for children. Spend more time outdoors. A good time would be morning or evening when it is not too hot. Limit near vision activities such as reading and screen time. Bring children for timely eye assessment. Teachers in school can help children to observe the 20-20-20 rule and allow them more outdoor activities. We need to rethink our children's school curriculum. More emphasis should be placed on outdoor-based learning. It can be as simple as conducting the school assembly or even normal classes outdoors, or have a longer physical education sessions. Children also would benefit from more breaks during class lessons and reduced intensity of homeworks. It is time for parents and teachers to advocate for holistic education that is engaging and that brings joy, pleasure, and life to our children, and not one that is based on intensive rote learning that makes education a chore. Policymakers also play an important, vital role. Governments worldwide have taken the challenge of myopia seriously and have commenced mitigating interventions at public policy level. Government-funded public health awareness campaigns and educational policies that de-emphasize rote learning goes a long way in reducing the burden of myopia progression. One great example is Taiwan. In 2010, as part of the Taiwan Student Vision Care Program by the Taiwanese Ministry of Education, a project known as Daily 120 promoted at least 2 hours outdoor activities per day. It was implemented nationwide in all schools and led to a dramatic and unprecedented reversal of myopia development among children in Taiwan. And finally, there are numerous effective treatment options that can slow down myopia progression. These include glasses or contact lenses that are specially designed to slow down myopia progression. Additionally, low-dose atropine eye drops have been shown in multiple clinical studies to be extremely effective in myopia prevention. You can find out more about these treatment options from your eye healthcare professionals. In summary, myopia, a short-sighted problem, needs far-sighted solutions. These solutions are already at hand. It is time for a concerted, collaborative effort to help our children. So let us join our hands and our hearts to fight myopia, and in doing so, give our children a clearer and brighter future. Thank you.